Hi guys, welcome back to my YouTube channel. This month I'll be sharing some of the things I know on pharmacovigilance and medication safety, and I'll be making two videos to talk about them, so I think you should stay tuned. One thing I've learned in practice is that patients don't typically come to the pharmacy and say, fam, I have adverse drug reaction. What they do is that they present with another symptom that they did not have before they start taking the drug, and sometimes they can be so sure that it's linked to the drug. Most times they ha other times they stop taking the drugs, but very few of them actually come back to the hospital to say, oh, they are feeling some type of way that they were not feeling before taking the drug. Now it's up to you as the pharmacist to link it and come to a conclusion if it's an adverse drug reaction or if it's actually just a coincidence. I'll talk about an example of a 15-year-old boy that I saw when I was working in a teaching hospital. This boy presented with angioedema. This was like the first angioedema case that I'd actually seen in real life. Like, I know how angioedema is supposed to look like, right? But like, I saw it in real life. His eyelids were swollen, like upper and lower eyelids. His eyes were just like line. His lips were swollen, his hands were swollen, his legs were swollen. He presented really terribly. And what happened? His mom had given him azithromycin like a day before because he presented with sore throat, and the mother said the last time she had sore throat and she was in the hospital, the doctor gave her azithromycin. So when her son came back from the boarding school and said, oh, he was feeling some type of way in his throat, she just, good mommy, went to a pharmacy and bought azithromycin, and it was bad. They had to rush the boy to A&E. Actually, like, I saw him on the ward in A&E. So yes, that's like a typical adverse drug reaction that you can link to the azithromycin that this boy took. So I think we should start by defining it. An adverse drug reaction is any harmful reaction or unintended response that a patient has when given a drug at a usual dose, recommended normal dose. And beyond defining it, really, I think the most important thing is being able to connect the dots to be able to say that, okay, this is an adverse drug reaction when you see an adverse drug reaction. And some of the things I've been learning is what we're going to be talking about in today's video. So here are like some of the things I'm learning about how to identify adverse drug reaction in practice. Number one is, when did this new symptom start? When was this new medication introduced? When did this new symptom start? When was this new medication introduced? If you are able to know the timing, okay, was this new symptoms, did this new symptom start immediately after this medication was introduced? Did they start 24 hours later? Did they start 48 hours later? Timing is important. Timing is very important when identifying adverse drug reaction. So if the new symptoms actually start shortly after the drug was introduced, or became worse when the dose was increased, or becomes less when the dose was reduced, or stops when you stop taking the medication, you can most likely link it to an adverse drug reaction, right? But if the time and the symptoms don't have any relationship at all, there might be a high chance that it is actually not an adverse drug reaction to that particular medication. Another thing to consider is if this is a known effect of the medication, if it is a known adverse effect of the medication. I believe that as a pharmacist, if you want to dispense a medication like ofenadrine or tizanidine to a patient, it's important that you tell the patient that, oh, this medication will make you drowsy, so that the patient just doesn't use it and maybe go ahead to drive or operate a machinery and discover that they are feeling drowsy and they stop taking it because they're scared. So I believe that another important thing is, okay, is this a known side effect of this medication? Is it already established that this medication is linked to this particular effect? If it's a known adverse drug reaction, I honestly think that as a good pharmacist, you should have mentioned something about it during counseling and how it is still safe. Like, reassure the patient that, okay, you're expected to feel this type of way when you start this medication. Just tell them about it so that they don't just have this reaction and they start thinking, oh, what is wrong? Sometimes patients will not even come back. They'll just stop using the medication, and I mean, this affects adherence, right? But if you have a situation where you notice that this is like a new effect, you have never noticed it in this drug before, or you've never seen any pattern like this, you read about the drug, it is not in any reference book, you don't know this about the drug, and you maybe notice that it is happening similarly in multiple patients are coming to tell you that they're experiencing this reaction to this drug, but it is not in any reference book, then it's important to document. Like from the first case you see, you report it. Subsequent cases, keep reporting it, because it means that that drug needs to be researched, it needs to be looked into. We need to be able to identify and maybe add it to the safety profile of this drug. Don't just say, oh, you don't know this about the drug, maybe it's not the drug that is causing it. What if it's actually the drug that is causing it? Not all adverse drug reactions are known. There are new adverse drug reactions that needs to be properly researched and like to be able to be incorporated into reference books and guidelines. So please, it's important that this is like something important to note. It could possibly be a new adverse drug reaction. Another very important thing is to think about the patients. Two people can use the same drug at the same dose, and one person has a reaction to the drug and the other person doesn't have a reaction to the drug. It's just normal. The drug works well with them. So this lets you now be able to say, okay, what about this patient is making them react to the drug? And there are so many factors that can actually be responsible for why one patient is reacting to a drug and another isn't. For example, elderly patients, geriatrics are very sensitive to medications and are more likely to experience side effects in medications. Why? Due to reduced organ functions, drug-drug interactions due to polypharmacy. Okay, a patient is taking one drug that is reducing the metabolism of another drug and is letting the other drug be available in toxic amounts, and this can cause adverse drug reactions. So you also have like patients that have liver problems, patients that have kidney problems. These patients cannot properly metabolize or excrete medications, and you can have toxicity. The drugs are in toxic level in them, and also these patients can also have adverse drug reaction. Genetics also play a very important role in adverse drug reaction, because our genes affect how drugs are being metabolized or even transported in the body. You can have patients that have low levels of YP450 enzymes, and these enzymes are required to metabolize drugs. So you can have patients that have low levels of these enzymes and slow metabolizers, and so you can have the active form of the medication accumulating in the body, leading to toxic amounts in the body, leading to adverse drug reactions or unwanted effects of the drug due to toxic levels. So just like everything I've said, in practice, it's important to note these three things when identifying adverse drug reaction. The timing. Did this reaction start when this drug was started? Did it stop when the drug was stopped? Did it come back when the drug was restarted? Is this a known effect of the drug? Is it already known? Has it been added to the safety profile of this drug? Is it known that this drug causes this thing? Or is it new? Do we have to research about it? Think about the patient. Is this patient elderly? Is this patient on multiple medications? Could this be drug-drug interaction potentiating this side effect? Could it be genetics in play? So many things to consider, and I really think that there's no hard and fast rule to it. It just means that we should be careful enough to think about so many things and string them together as pharmacists to identify adverse drug reactions. This is because, to be honest, identifying adverse drug reaction is putting together all of the clinical clues and making sense of it to be able to say, okay, is this drug responsible for causing this reaction in this patient? If you ask me, I think identifying adverse drug reactions is one of the most important roles you can play actively as a pharmacist. So if you found this video helpful, I think you should subscribe to this channel and turn on your post notifications so that you'll be the first to know when we have a new video. You should also share this to your community. You should send to pharmacists that you know. You should send to pharmacy students that you know. And we'll be here again in 2 weeks for another video. Bye. See you next time.